H.
Pylori.
H.
Pylori.
H. Pylori. H.
Pylori.
H.
Pylori.
H.
Pylori.
H.
Pylori. Alright, thanks guys. I think we get the picture. So we're going to be talking about therapy today, and we're going to be talking about a 45-year-old female who presented to the clinic last week complaining of intermittent abdominal pain that has been present for about 3 weeks. She said the pain has been worse between meals and in the early morning hours. She also experiences a burning pain in her epigastrium and reported increased burping. So she also complained that the aforementioned symptoms affected her lifestyle. A Helicobacter pylori breath urea test was completed and the results came back positive. So this patient presents today to discuss the treatment plan with us. Let's take it from here.
Come in.
Dr. Amanda, do you have a moment for me to run a case by you?
Sure, sit down. Tell me about your patient.
Thank you. So, I've got a 45-year-old female. She's complaining of intermittent abdominal pain. It's been present for about 3 weeks and worsening between meals in the early morning hours. She's having burning pain in her epigastrium, and H. pylori breath urea test came back positive.
Okay. Does she have any allergies?
No allergies, no environmental allergies, no problems with drugs.
What medications is she taking?
Just a multivitamin.
Has she been prescribed bismuth or antibiotics recently?
No, she hasn't even seen a provider in over a year.
Does she have a history of peptic ulcer disease or previous gastric surgery?
No, she doesn't have any uncomplicated medical history with major systemic diseases.
Okay, is she pregnant or lactating?
No, she actually went through menopause last year.
Okay, so what's your question? What's your clinic care?
Well, what I learned in school is that a 7-day triple therapy is the standard treatment for H. pylori.
Well, it sounds like you residents need to get up to date, Ike. Unfortunately, the success rate of that recommended treatment is fallen under acceptable range.
Oh, I wasn't aware of that.
There's some new research about more effective strategies for treatment of H. pylori.
So, what are the recommendations?
It's the addition of bismuth and extending the treatment from 7 to 14 days. The bismuth actually provides a synergistic effect with the antibiotics.
Where'd you get that info?
Well, I found it in PubMed.
Well, will you tell me a little bit more about the study?
160 patients with functional dyspepsia who were tested positive for H. pylori were randomized into 2 groups. The drug regimen was omeprazole 20 milligrams, amoxicillin 1 gram, clarithromycin 500 milligrams, and bismuth potassium citrate 220 milligrams, BID for 14 days. The extension of the treatment led to a significant increase in H. pylori eradication, up from 80% to 93.7%.
Well, how long did they wait to test for H. pylori after the treatment?
6 weeks after the treatment was complete, they tested with a urea breath test.
So did the study discuss the resistance rates?
Yeah, what they found was that the eradication of clarithromycin-resistant bacteria increased from 36 to 85% when the duration of treatment was doubled.
But aren't there more adverse effects when the therapy is given for a fortnight?
Good question, but no. The number of adverse effects were comparable.
So according to this study, I should prescribe quadruple therapy for 14 days as the first-line eradication regimen for this patient.
Yes, because the clarithromycin-resistant rate in the United States is about 32%, so chances are a 7-day treatment isn't going to cut it.
Oh, that's cool. Will you mind emailing me a copy of this study?
I could, but I think you'd be better served by doing your own PubMed search. Adult learning, Ike. Adult learning.
Okay, then. I'll get back to my patient.
Take care, Ike.
Krista, thanks for making this appointment. I wanted to discuss with you the results in person.
Oh my god, does she have cancer? Sorry.
No, Krista does not have cancer. She has H. pylori. It's just a bacteria.
That sounds worse than cancer. H. pylori?
Well, it's not worse. It can be treated with antibiotics.
Okay, well, that sounds easy enough. So you're just going to write me a prescription today, right?
Yeah, that's the plan. But I wanted to discuss the treatment course with you first. In the recent past, H. pylori was treated with what we refer to as triple therapy for 7 days. And however, the treatment course is proving to be less and less effective, so I'd like to put you on a quadruple therapy for 14 days.
That sounds like a really long time.
So you're saying more meds and more time?
Yes, because ultimately the goal is one powerful course of treatment, and then that will likely minimize the need to have a retreat to minimize any resistant bacteria.
Okay. So if I heard you right, you said 4 medications? What medications?
Starting off with omeprazole, amoxicillin, clarithromycin, and bismuth. And you'll be taking all of those twice a day for 14 days. Both antibiotics should be taken after meals, and the PPI and the bismuth should be taken before meals.
That sounds like a lot.
I know it seems like a lot, but it's important that you not only start the therapy, but that you finish it. Just like any other antibiotic, we got to make sure that it's done.
But what if she can't? I mean, she's really sensitive. What if she is sensitive? I don't know. I mean, you're like a delicate flower. I just want to protect you. So, I guess like what are these side effects?
Well, starting off, we've got stomach, back, leg, chest, and joint pain, indigestion, gas, diarrhea, vomiting, sometimes with blood, headache, insomnia, rash, hives or welts, redness, soreness or itching, vaginal itching or discharge, stomach cramps and bloating, black, tarry, or clay-colored stools, bleeding gums, blistering, peeling, or loosening of the skin, dark and bloody in the urine, pain or difficulty urinating, sudden decrease in the amount of urine, chills, cough, difficulty with breathing and swallowing, dizziness, fast heartbeat, fever, general body swelling, heavier menstrual periods. Yay, menopause!
There's one good thing.
Increased thirst, inflammation of the joints, pale skin, puffiness or swelling of the eyelids around the eyes, face, lips, or tongue. Red, irritated eyes, sore throat, sores, ulcers, or white spots in the mouth or on the lips. Swollen lymph glands, tenderness, tightness in the chest, unpleasant breath odor, unusual bleeding or bruising, unusual tiredness or weakness, unusual weight loss, wheezing, yellow eyes or skin, acid or your stomach, belching, passing gas, or feeling full. General feeling of discomfort of wellness, usual tiredness or weakness, loss of appetite, runny or stuffy nose, sweating, trouble with sleeping, burning feeling in the chest or stomach, congestion, dizziness, hoarseness, pain during sexual intercourse, sneezing, and voice changes.
That is ridiculous. I lost you halfway through. I don't even know half of what you said. But it all sounds so much worse than what I'm dealing with right now. So why would I take all these medications?
Well, the repercussions of not treating H. pylori may ultimately lead to cancer.
Cancer? You said it was bacteria.
It is, but the damage that bacteria can do to your GI tract can effectively lead to cancer.
Wait, did you mention like vaginal discharge in that long list?
And bad breath?
Oh god, you're already belching like a truck right now. You're gonna take medication that could potentially make it worse. We're meeting my parents this weekend. You're meeting my parents this weekend.
This is just for 2 weeks. What other concerns do you have besides those related to the side effects?
Well, you said cancer, so if I don't take the medication, I could get cancer. So I guess I have to take it.
Well, ultimately the treatment plan is your decision, but this is one I would highly recommend.
I support your decision.
Okay, well, I'm gonna go write out these prescriptions and I'll be back in a few minutes, okay?
Okay.
So, I mean, I guess this is happening. Like,
Yeah, you're not gonna leave me, are you? All these side effects?
I mean, can we still, like, be intimate when you're on these things?
Well, I think so, but maybe we should ask.
Do you think it's contagious?
I doubt it. I mean, it's in my gut, right? I mean...
I know, but...
Don't you think you'd already have it if it was contagious?
Maybe, but... I mean, have you been cheating on me?
Of course not.
Okay, sorry. I'm stressed. So wait, if one of the side effects is yeast infection, you get a yeast infection, I get a yeast infection, and then, like, we're just passing it back and forth. They'll never go away.
That's a good point. We should definitely ask about that. What else? What else should we ask? You think we can push off meeting your parents? Or me meeting your parents for a couple weeks?
Maybe.
Well, let's give them a call right after the appointment.
Okay. Wait, are you gonna lose more weight?
Maybe. I guess there might be some good side effects of this. They did say weight loss, I think.
Yeah. Well, as long as I don't get, like, this weird yeast infection, then I guess I'm okay.
Alright.
Okay.
Come in.
Okay. So, your prescription should be ready for pickup in about 20 minutes. Do either of you have any additional questions or concerns?
No.
All right then. I'll tell the receptionist and we'll be in touch to schedule a follow-up in about 8 weeks.
Okay. Thanks.
Okay, thanks for coming in. You always treat me like a child! Sorry. It was covered. You had it covered. Okay. I had to get
That's it for me.
So, did the study just,
Come in.
Hey, Dr. Amanda, do you have
It's not even. We haven't even started yet.
between meals? In the early
You
morning
said
hours.
down.
Did I?
You did. I promise. I promise you said that. Okay, get it together.
We had to move the camera.
Stoic.
I was like...
Amoxicillin, clarithromycin, bismuth, clarithromycin, and bismuth. I can't say that.
Just say bismuth.
I should just say bismuth.
Bismuth potassium citrate.
It's the specificity of bismuth.
Okay. Let's see how
How close up are you?
It's so
Get
close.
away.
No, this.
That was pretty good, guys.
You're welcome.